Here's a letter from a group of approximately 60 post-community service doctors who say they're contractually bound to work for the Gauteng Department post-community service. This is to repay bursary funding. So these were students who were trained to be doctors, funded from the public purse. What could go wrong, you think? Well, the difficulty they have now is finding placements within the public system. They can't go to the private system because, of course, they were funded from the public purse. But if they're not being placed, what must they do? In communications with officials from the department, they've been told that they're ungrateful and they should consider the students who are sitting at home because they weren't funded. And we're going to find out exactly what's going on with this. We've got one of them on the line who has bravely decided to come forward. She is not using her real name for fear of reprisals and victimizations. So we'll call her Alice for our purposes. Alice, a very good morning to you. Thank you for talking to us. Did I set it correctly in my introduction there? There are about 60 of you and you can't find placements?
Yes, definitely. And thank you so much for taking on our story. So that's exactly what's been happening to us. There are about 60 of us in the Gauteng Department of Health specifically group who were funded by the department. And now that we're supposed to start working to pay back our bursaries, there haven't been any placements for us.
What's the reason you've been given for not being placed? I mean, in other words, isn't this something that perhaps takes a little bit of time? Don't you just need to be patient and they'll sort it out for you?
So in terms of previous years and how bursary obligations have worked, this works similarly to internship. When you finish your medical degree, you know that you're supposed to be placed for internship. The government needs to know or knows that in time they need to prepare for those posts. So if it is that they need to sort out budgets and they need to have allocations that they make in different hospitals, they do those things in advance or should do those things in advance so that in the coming year you're placed and you start working.
Because it's not as if they didn't know you were coming, yeah?
Exactly. So in terms of post-community service workers before, that's how it's been happening. And that's how it's happened in other provinces in the country, where people post-community service have been contacted by the government and have been allocated for placement. So in our case, there hasn't really been a clear answer as to why this wasn't done in advance. But when we do ask, we're just told that we have to be patient. They're calling people, they're making plans for us, and they'll eventually come through to sort us out.
When were you expecting to be placed?
So in my understanding, they should have contacted us towards the end of last year to start speaking to us about our bursary obligations, how long we still have to pay back, and where we want to work so that we can start. However, in January, that's when the bursary discussions only started happening. But with our Gauteng Department of Health South African trained group, we were treated a little bit differently. So there's two groups in our setting. There's a group of NMFC Cuban trained colleagues that we have, and then there's us, the Gauteng Department of Health bursars. And I say them as separate groups because that's how they were managed, as separate groups, even though we're all Gauteng Department of Health bursary holders. So in that first 2 weeks of January, the Cuban trained group of our colleagues were contacted. A group was made for them. They were called to physical meetings that they had at the department. They were given updates and a plan was made for them, and they were all placed around the second week of January. On our side, a friend of ours in the group had to, on her own, make a group, contact people that she knows, who she knows are post-community service, who are funded by the department. She had to get them to invite their friends to the group, and then the coordinators were then invited to join our group. So we pretty much had to collate ourselves, get in contact with them ourselves, make a list of ourselves and send that to them so that they could start working to try and allocate us. So in general, it doesn't seem like we were ever really part of this plan.
I've seen, in fact, screenshots of the WhatsApp group that involves the Cuban-trained colleagues of yours. When you pointed this out to the officials in the Gauteng department, they got angry, didn't they?
Yes, they did, because on the group of our Cuban trained colleagues, and I really must emphasize that we have no anger or animosity towards this group of colleagues, because just like us, they were waiting to be placed by the department. But the way that the department went about it, it made it so that they had to be secretive about their placements. They were told not to not to tell us that they were placed, and not to share any information on the group, because we would be upset if we found out. And when it did eventually come on to our group, because again, we know these people, we've worked with them, so it's quite impossible to limit that communication. And when it did come to our side and we shared it on the group and asked the coordinator what's going on, because in that very day she had told us that nobody's been placed, nobody has jobs, everyone is still waiting. And when we asked her, she basically was admonishing us for firstly having had access to this information. She was shouting at us for, where did you find it? Who sent you this? Instead of answering why there is that content if nobody's been placed. And in terms of answering why we're being treated differently, is the same going to be done for us? She just ignored the messages, and we didn't get any communication after that about that subject.
Did she not call you ungrateful at a point?
Yes, she did. She said that we're ungrateful for saying, because one of the colleagues said they wish that we had been funded by other provinces, because other provinces seem to have taken priority by freezing posts and making sure that their bursary holders as a group in total are allocated before everyone else, as should be, because we have contractual obligations to the government. And the coordinator said that we're ungrateful. We were funded by the department, and the only reason why we're qualified doctors today is because the government funded us. And now we have the nerve to be sitting here saying that the government is basically disorganized and doesn't care for us because they haven't made a plan to place us.
Now, Alice, explain to me, why can't you, if they can't give you placements, why can't you go and work in the private sector?
So working in the private sector, based on the contract that we signed, is going to be a breach of contract, because we're still, quote unquote, under government service. And if we do want to leave these contracts, that is a possibility, but you have to pay the government back the money that they funded you. So for me, for instance, I was funded by the government for 5 years. So if I've been funded for 5 years and my tuition was about 100,000 Rand a year, that means I have to come up with 500,000 Rand to give them before I can leave to be free to go and work in private. And naturally, we all don't have jobs. We've been unemployed since the beginning of the year. Our last salaries were in December, mid-December. None of us have the money to give them so that we can be released from these contracts. And when we do ask on the group, and it has been asked multiple times, if we can be released without consequences, we're reminded that we signed a contract and this contract binds us to pay. So if you want to out yourself as working in private, you can, but you should know that that's going to come with some financial obligation to you for a bursary that you're going to need to start paying back. And that's an unfair expectation, because we aren't insisting that we want to leave. We would be very happy to work our time back, but we also at the moment do not have an income. So I'm very lucky because I don't have children or any other responsibilities, but a lot of people have bonds, they have children, they have school fees to pay, and those things don't stop just because the government is still trying to figure themselves out.
Gotcha. And who's got 500,000 Rand lying around, right, as spare change? Alice, why don't you stay on the line, because of course the department is here to explain themselves.
702. Right of reply.
Dr. Basani Baloyi is the Deputy Director General for Corporate Services at the Gauteng Department of Health and joins us now on the line. You heard all of that Alice had to say to us. That's pretty damning. What's your response?
Good morning, Bongani, to the 702 listeners. I'm not Dr. Baloyi, I'm Miss Basani Baloyi.
I beg your pardon?
And thanks for having me. I've heard what Alice has said, and we sympathize with them. But I wish to correct something that, you need to understand. That in the entire country, if you heard what the Minister of Health responded in Parliament, is that at the moment, we've got 424 doctors that need to be placed, and that team falls within that ambit. But I would like to speak specifically, for Gauteng. Firstly, I would like to start by saying that, for the first time that you see that, we do not have any challenges with the placement of post-community service doctors, in a while. with Gauteng, we've never had any other doctor that has been placed in our hospital and not paid. It's because of our turnaround strategy that we have implemented. But again, I want to also come back to what Alice is saying. We cannot compare the South African trained doctors with the Cuban doctors. And I wish to report to you today that, in Gauteng, we've got, two categories of medical doctors who are bursary holders. The first ones are the Cuban trained doctors who are 74. And then we've got the South African university trained doctors who are 86. And again, when we look into the placement for community service doctors, we're not only placing those that are bursary holders who are placed by the national department. They placed more than the number that have been trained. And it is also good to note that, South African universities are producing more than what the system needs at a
Basani, here we go.
point in
Basani,
time.
you're talking around this issue, and I'm not getting much clarity from what you are saying. You're saying, for example, now they're placing more than have been trained. And if that's the case, why is somebody like Alice sitting at home? And
I want to talk to it, Bongani.
But you're
if you
not.
can give me an opportunity. No, because I want to rebut what Alice is saying. And for me to respond to that, it's also for her to understand, the system, because they've not given you the clear indication as to why are we where we are today. And
let's simplify it, Basani. Let's simplify it. I'm going to ask you a direct question. Why is Alice and her colleagues, why are they sitting at home and not placed?
To date is that, they competed with other doctors for other positions in other institutions. And, as you can appreciate the fact that even if we've got, 86 bursary holders, they're placed in different hospitals. So some of the medical doctors, to date, I can share with you that we had, for instance, 86 doctors, and we have placed 210, non-bursary holders. To date. And we continuously...
Basani, I'm going to ask you again. Why is Alice sitting at home?
Alice is sitting at home because of, at the moment, we do not have enough funds to accommodate, her. But we are working around the clock to find money.
So what must you do?
She should wait up until we've got money to do so.
When will that be? Hold on,
Bongani,
Basani. It's not as if you didn't know these students were in the pipeline. Until when must you wait?
Bongani, that's what I said, that give me an opportunity. It's not like we are not appointing doctors. We have appointed more doctors. And unfortunately, Alice is one of those. It's not like even in their cohort, we didn't appoint all of them. Some of them have already been appointed. She says of the
group of 60 of her colleagues, only 5 of them have been placed, and that's due to their own efforts and not yours.
But even her figures are incorrect. Her figures are incorrect.
So of that group, of that cohort,
only 40 have not been placed to date.
That's nearly half of them. That's nearly half of them. That's not a star on your forehead.
Yes, I agree with you, Bongani, about what you are saying. But at the end of the day, the fact is we need them. If I had the budget today, I'll even take the entire 40 to Sebokeng Hospital because they need more doctors. So
here's the thing. You don't have the budget.
But the challenge that we have is that we don't have enough resources.
You've explained you don't have the budget. They must now sit in limbo. Why don't you release them from their contractual obligations so they can find work in the private sector?
Hence, I've even said, even the provisions, in their bursaries, we have said that if we cannot place them, they are released.
What do you mean?
They are released from they don't need to stay with us, and we're not gonna even demand, the money from them. We'll release them from their contract. If they come to us and say that I have been appointed at Mill Park Hospital, we'll be happy because they'll still be saving the country.
But that's not what you've said to them, Basani. Their communication they have received has always been that they are threatened with paying back the money if they leave the public sector and go find those placements in the private sector. That's not what you've been communicating to them.
I'm not aware of that, Bongani. If Alice can become the real Basani and come to me and show me correspondence, I will deal with it. I'm not aware of any threats that have been communicated to them, and this has been our consistent message, even with the nurses and other physiotherapists and other community health service professionals that have been placed in our institutions. If we cannot place them and they can be placed somewhere, we will release them from their bursary obligations. They need to not to pay us back.
Here we go. Can I ask you then to issue some kind of directive in writing, send it to these students, to all of them, and explain to them that if they are not able to be placed in this financial year, you are officially releasing them, and then we can follow up the matter from there?
We will do that. We will do that. If they come forward...
No. I don't want them to come forward because they are afraid of reprisals and victimizations. I'm saying to you, why don't you issue...
We have no reason, Bongani, to victimize them.
Why don't you issue... Then fine, simply issue a blanket directive saying, henceforth, if you are not able to get a placement, you are free to pursue the private sector and there'll be no consequences. Why don't you just do that?
Bongani, that was done last year, and I don't understand because where they were practicing, that information was there. So that's what I'm shocked that
you can send me that directive. You can send me that directive dated last year.
We will do that. I mean, that is common knowledge, and for me, it's. I don't find any reasons why we should be threatening doctors, and I don't find any reasons why if Alice is appointed, for instance, at Netcare, we cannot release her because at the moment she's not placed.
All right.
But it is our intention to place them. And we are working around the clock with everyone to ensure that, we secure funding in order to appoint them in our hospitals because we need those doctors.
All right. Basani Baloyi, I appreciate your time. That's the Deputy Director General for Corporate Services at the Gauteng Department of Health. Alice, I have to ask you this question just as we round it off very quickly. She says this is common knowledge. You were free to go last year already. What's your problem?
No, that's untrue, especially because we might not have communicated with her, I think, because she's more on a more senior level. However, this is the information and the communication we've received from their appointed coordinator. So we're not going to work outside information that we haven't been given because these are our lives. And I think this is one thing that they seem to forget, that these are our lives. We're sitting at home and the just wait indefinitely and we'll see if we can find funding. They've affected our lives so negatively.
All right.
And for people who've given so much of their time to
I'll tell you what,
government,
Alice, I'll tell you what, we will behind the scenes work with the documentation that you have and what's been communicated to you, and we'll see if she'll produce this directive she says is common knowledge, compare the two and try to get you moving forward on this. Appreciate your time and coming forward, but that is the case. I'd love to hear from those of you who heard that whole exchange, your thoughts.
Current events, developing stories,
tough questions,
your voice making a difference.
This is Breakfast with Bongani Bingwa.